You know this thing, I have to.
Welcome to our second talk for the series in the driver's seat, aging with intention. For those of you who are joining us for the first time, this is a series of talk focused on enabling us to be intentional in making choices that will allow us to live a purposeful, healthy, and productive life as we age. The talks are held every month on the last Saturday of the month at 10 a.m. We encourage you to send us emails with topics you would like us to handle, to address in the future. And you can also send this on email and the various contacts which we have displayed. This will help us to plan better and find the most suitable speakers to address these sessions.
Sweetie, where are you? Let's go.
We deeply apologize for those of you who sent questions and we did not address them during the last session. We are going to endeavor to present in time and also have enough time in our Q&A to address all your questions and comments. And we hope that you shall be empowered by this session, and we look forward to another lively session discussion every end of month, Saturday end of month. I think we shall share some housekeeping rules. Can we try to keep our speakers on mute and probably our videos off, because you might be caught up doing something you don't intend us to see. So throughout the session, please put your comments, your questions in the chat, and we shall be keeping an eye on the chat so that we can address all the questions and comments. It's 5 minutes past 10 o'clock, and would like to start and keep time this particular Saturday. And I'll therefore I'll go on to the next session, which is introducing our guest speaker this morning. I'm honored and privileged to introduce Dr. Gyaviira Makanga. He's a Ugandan medical doctor, a physician trained in Uganda with specialist training in nephrology, that is kidney diseases. Dr. Makanga has specialized in hypertension, high blood pressure, and while receiving this specialist training, he had an opportunity to manage patients both in kidney diseases and hypertension in various countries like Tanzania. He practiced in India, he practiced in Norway, and in Uganda, he has had a long period of practice in Mulago Hospital Kidney Unit. He has been involved in teaching students at Makerere University College of Health Sciences, which we used to call the medical school. Currently, he works with the Bank of Uganda Specialist Clinic, where he's actively involved in managing retired senior citizens, which is a plus for us, and bank staff. Dr. Gyaviira also does pro bono, that is free. He offers free services as an honorary lecturer at the School of Medicine, Makerere University. And he also, at part-time basis, works as at the interim organ and tissue transplant working group. As you have heard, Dr. Gyaviira has a rich experience, and we are blessed as seniors this morning to have him as our guest speaker. And without wasting more time, I would like to invite Dr. Gyaviira to come and present to us. Dr. Gyaviira, you're welcome.
Thank you so much, Dr. Christina, for the humble and kind introduction. And good morning to you all. I think others, it might be an evening or night. You're most welcome to this talk. And I want to thank the organizers, the special ladies that put this together, Philippa, Tina, and Dr. Christina, whom I humbly also refer to as mother-in-law. I also want to welcome the senior citizens that I can see on the talk. Thank you for coming on to share my experience about this condition that is quite common and very passionate to me. I think I'm also seeing quite a number of people out of the continent, and I want to welcome you all. I've got probably a brother and in-law, Darlene, all the way from Australia. Thank you for joining in, and we'll be glad to hear the experience from the other side of the world. So I would like to share my slides right now. I hope this is clear to everyone. So the topic I was asked to share with you in the next probably 20 or so minutes is hypertension, also called high blood pressure, and living with this condition as a senior. And like I've been introduced, I'm a doctor currently working with the Bank of Uganda. So this is going to be the outline of my talk. A brief introduction will remind ourselves all. I will let you know what we mean when we say high blood pressure. I would like to discuss those who are at risk of getting high blood pressure, all in particular because the talk is going to be tailored to senior citizens. And my definition for the purpose of this talk, senior citizens, I'm referring to people who are 60 years and above for the purpose of this talk. And we'll look at what high blood pressure presents with, the complications, and then the management. And then we'll probably have enough time for a Q&A session. There are a few questions that came in a few days ago that I'll try to address within the talk, and others probably will be addressed after. And before I start, I wanted to highlight this main issue that probably this topic came in at the right time. The month of May has been dedicated as the blood pressure month, and the 17th of May, which was just a few days back, was set aside as the World Hypertension Day. So every 17th of May worldwide, this day is celebrated and with an aim of increasing awareness about this disease because of the burden that it causes in terms of morbidity and mortality to a very big number of people. And this is a disease that affects everyone. It can affect babies as young as 1 day old to the oldest person living. So none of us is immune from this condition. And the theme for this year's World Hypertension Day was measure your blood pressure accurately, control it, and live longer. So this was the coin. Last year, there was another theme, but this was the main theme for this year. And our talk, or my talk, is going to be focused on basically the theme of this year. Now, high blood pressure is also referred to as the silent killer, one of the other silent killer diseases, and we'll see the reasons why, but majorly because it's a disease that has no visible indicators many times. So we might be seated here, I don't know how many we are, a number of us may actually be having high blood pressure without knowing. So before I introduce the main topic, I wanted to dispel a few myths that we come across. Just like the last talk on mental illness, my colleague, Dr. Noelin, listed down a few myths about mental illnesses. Now, these are some of the few myths about hypertension. And one of them that we find behind in our consultation rooms that the patients ask us is, if one feels fine, then they do not have high blood pressure. And like we shall see in the talk, this is not entirely true. Second, that there's a cure for high blood pressure. Now, we do not talk of a cure per se, but we talk of control. And then others usually would tell us that I would notice if I have high blood pressure. And like I said, because high blood pressure is a silent killer, many times you will not know until you measure your blood pressure. So this is also not true. Then there is this interesting one. Wine is good for the heart. And because it's good for the heart, because it has been written everywhere in the media, people have read about it. So go ahead and drink as much as you want. Now, this is not true, like we shall see in the talk. And then this is a very common one that we encounter almost every day. In my few years of experience, I see this quite a lot with almost everyone, but with a good number of senior citizens, that when they take their blood pressure medications, those who have already high blood pressure and the blood pressure is controlled, many of them actually stop taking their blood pressure medications because now they feel fine. But then they forget that what actually brought down the blood pressure and controlled it was actually the drugs. So this is not entirely true. And please don't do this until your doctor says so. And then another myth that we come across is about salt. And we'll have a few slides. We'll have a few slides discussing about the impact of salt and its association with our topic today. So some people say because they don't use table salt at their dinner tables, then there is no need to worry about too much salt. So we'll see why this is not entirely true. So all these myths are definitely false. And we'll as we go along, we'll be discussing many of these. So what do we mean by high blood pressure or blood pressure per se? So blood pressure is basically that force that the blood exerts against the walls of the blood vessels that basically transport blood to all your body organs. And this force is generated by our heart. So if you look at the two cartoons that I've put on your right, there are two figures that we use to express the blood pressure reading. There's always an upper reading and a lower reading. Now, the upper reading simply indicates that force when the heart pumps blood out to supply blood and nutrients and oxygen to the various organs. it uses a certain force to push that blood into the blood vessels. So as it pushes, if I'm to use a pointer, as it pushes out, there is some kind of force that it exerts on these blood vessels. And that's what we call the systolic blood pressure. That's the reading that we indicate above. Now the heart is a pump, and it's a natural pump. It cannot pump like the machines continuously. It has to get a few seconds of rest. Now that time of rest, there is still some kind of pressure that is within the blood vessel. So during that time of pressure, that pressure that is within the blood vessel during the time of the rest is what we call the diastolic blood pressure, and that's the lower blood pressure reading. Now, what are the numbers like when we say high blood pressure or low blood pressure? Now, this table here that I reference from the American Heart Association is also quite common. I'm sure many of you have come across it. So green is good. As we go down into red, we are getting into the dangers of this condition I'm talking about. So the normal blood pressure should be 120. That is the higher reading. Sorry about that. So the normal blood pressure, like I said, is now remember that I mentioned that there are two readings, the upper reading and the lower reading. The upper reading is the systolic, is what we call the systolic during the time when the heart is pumping. The lower reading, once again, is when the heart is at rest or in between the beats. So the green here is showing the normal ranges that we want everyone to have. That is an upper reading of 120 and below, and a lower reading of 80 and below. So anyone who falls between this range of 120 to 139 as the upper reading and the lower reading between 8 and 89 is what we call pre-hypertension. Now, these people here many times are not on treatment, but we keep a sharp eye on them and we keep following them up because they are very likely going to slip into the lower categories of 140, where that definition of now high blood pressure or hypertension starts. So our definition, even for this talk, is going to be any reading of 140 and above as the higher figure, or a reading of 90 and above as the lower figure is high blood pressure or hypertension. And it becomes very severe as you go down. So when we get to, for example, the red, the bottom, where it's the hypertensive crisis, a reading of 180 and above, or a lower reading of 110 and above, this is really an emergency and needs urgent attention. Now, I won't leave this slide because someone will also ask, what about low blood pressure? So low blood pressure, we don't want this upper reading to go below 90. So when we go below 90 or go below 60 on the lower side, that is low blood pressure, and it equally has dangerous effects or even more, just like the higher reading. But for the sake of this talk, we will actually talk more about the upper readings. So what is the burden of this problem? And I took this from the World Health Organization statistics. The small circle down at the left corner shows what we call a global prevalence of high blood pressure. And what this means is that out of the about 6 billion people in the world, 22% of those, which probably translates to about between 1 billion and about 1.5 billion, actually have this condition. They could be more because there are so many that do not know and have never actually measured. And these are regional differences, but you can see by and large, if we look at them regionally, Africa here is 27%, Europe is 23%. And what this means is that, for example, if we take Africa, What this means is that in every 1 to 4 people aged probably between 30 and above, one person is going to be hypertensive. Now, if we break this down to Uganda here, the statistics are quite worrying. And I got this from the Ministry of Health statistics, where it's estimated that about 500,000 deaths actually occur because of this condition, hypertension, all the related complications that we're going to see. And the studies that have been done by a few of my colleagues referenced below have shown regional differences, but the condition is quite common and it ranges between 15 to 29%. And this is in agreement with what I've just alluded to worldwide, where 1 in every 4 adults actually has this condition. Now, sadly to note, is that less than 30% of those with high blood pressure are actually aware of their diagnosis. Now, what this means is that the other 70% actually do not know that they have high blood pressure. Now, still more worrying is that those who have actually been diagnosed with high blood pressure and have been placed on treatment, a very small percentage of them are actually well controlled. That's less than 10%. And this has been seen even here in Uganda. And I also see this quite a lot with the senior citizens that I see at my place of work. And there are very many reasons why this happens, and we'll discuss this, especially in the elderly. So this is the distribution of Uganda in terms of high blood pressure prevalence. And like you can quickly see, for those with eagle eyes, that the southern part of Uganda seems to have a bigger burden of this condition than the northern part. There might be many reasons, probably lifestyle changes that we're going to talk about might be practiced much more in the southern part than the north, or it could be a difference in the genetics, or it could be a difference in the food patterns. But these are things that are ongoing, and there are quite a number of groups studying this condition in the country. So this again basically is a small summary of what I've just been talking about, that globally, including Uganda here, there is very poor control of high blood pressure. And because of this very poor control, we get lots and lots of complications of this condition. In my area of specialty, which is kidney diseases, many of you have probably heard about dialysis. For every 10 patients who are on dialysis, dialysis is basically a condition where your kidneys have failed. And one of the commonest causes of kidney failure worldwide, and even in Uganda here, is actually high blood pressure, poorly controlled high blood pressure. So, and this here is basically depicting exactly what I'm trying to say, that a very good number of people are unaware that they have high blood pressure because they never measure. And this is because probably they think they feel so well or very okay. And that's one of the myths that I discussed. And then those who are aware are probably not treated for very many reasons. And then those who are treated, there is very, very, very poor control. And then we have a very small percentage, the gentleman here or lady in blue, who is celebrating because the pressure is controlled and they're probably living a very good life. So why is it important to discuss this topic? And it came in right handy. Now, like I say, this is a disease of the heart primarily and the blood vessels. And if not treated, it causes damage to what we call the vital organs. And basically it will have a very, very negative effect on almost all the body parts, but there are particular organs that we call vital: the brain, the eyes, the heart, and the kidneys. So in the brain, there are complications like stroke, there are complications like dementia or Alzheimer's disease, confusion or convulsion. Others have actually had convulsions. Others have gone blind because of high blood pressure. Heart attacks are quite common. or heart failure, because the heart, because of the damaged blood vessels, the heart has to use extra force to push blood into these damaged blood vessels. Now, what blood pressure actually means is that these blood vessels actually keep narrowing. And because they are narrowing, this pump, the heart, has to use extra force. And in so doing, it's actually weakening. And it's because of the narrowing, there is actually reduced blood supply to all these organs that I've mentioned. When it comes to the kidneys, of course, you're going to get kidney failure. And it does also not spare the reproductive system. So this is another very common and probably undetected problem, the sexual dysfunction. And if death is a complication, high blood pressure will also cause many deaths. And like I already alluded to, the Ministry of Health is giving us very disturbing statistics of 500,000 people dying every year. And this could actually be underreported. So it's very important to know these figures and to know what your status is about this condition. So who is at risk of getting this condition? There are so many risk factors for high blood pressure, and we will categorize them into those that are modifiable. In other words, risk factors that can be reversed, and those that we probably have nothing to do about. So among those that are modifiable or potentially reversible, we have people who have, say, pre-existing high blood pressure. What I mean here is there are people who have had high blood pressure probably way back and was controlled, so they went off their drugs. Now, these usually will have a very high risk of actually getting high blood pressure again. A very good example of this, of a category of this group of people are the pregnant ladies who develop high blood pressure during pregnancy, and then it's controlled following delivery. Now, we want to keep a close eye on such mothers because later on in life, they have a very high risk of getting high blood pressure, especially as they age. Diabetes is another one, a very big risk factor for developing high blood pressure, especially in the senior citizens. High cholesterol or high fat in your blood. Physical inactivity, which is quite common these days. Excessive alcohol consumption, and we'll have a discussion briefly about this. Cigarette smoking. Now, all these cigarette smoking, excessive alcohol intake, excessive salt intake, and I actually put this in red because it's very important. And I will also try to break it down and what we mean by excessive salt intake. All these damage the blood vessels and the heart. Now, stress, these days, there's lots of stress from quite a number of causes. We know the political environment is not the best at the moment. The economic environment is not the best. And these are all drivers of excessive stress, and it will lead to actually high blood pressure. Now, medication is very big. I also highlighted this because there are medications that we are taking that we might think are actually innocent, but actually cause high blood pressure. And I'll give examples of these. Overweight and obesity. This is a worldwide problem now, and we are seeing it even in the young children because of the lifestyle changes. Social deprivation or isolation. This causes actually stress. Pollution in air, in water, in foods. There are particular substances in food or in the air or in water that we take that are potential causes of hypertension because they damage blood vessels, damage the heart, or damage the kidneys. The other is poor sleep. In fact, in one of the questions that came in earlier, I think it was from a gentleman called Herbert, who highlighted his very busy schedule. He hardly sleeps. I think he mentioned he takes, I think, about 2 hours of sleep each night. Now, poor sleep has been attributed to very many health conditions, and hypertension is one of them. mental illness is the other, and many others. There's a condition we called obstructive sleep apnea. This obstructive sleep apnea usually happens in people who are quite obese and snore quite a lot. And usually it is usually reported by the spouse or a family member that so-and-so actually does sleep or snore a lot in the night and keeps waking up. This particular condition actually is another cause of high blood pressure. Now, these are some of the modifiable or reversible or controllable risk factors of hypertension. Now, just to go back about cigarette smoking, there's something that is called shisha that is quite common in the bars around town. And I think the young people tend to think that shisha is innocent. It is not at all. It will also do the same damage that this ordinary cigarette smoking does. Now, when we cross over to the non-modifiable risk factors, the ones that we cannot do much about, advanced age. And this is probably one of the main focus of our discussion today, why living positively as a senior citizen with high blood pressure, or preventing it in case you do not have it. So, but as we advance in age, the risks of getting high blood pressure actually increases. And science has told this, has proven this over the years. The males seem to be at a higher risk of getting high blood pressure. And this has also been studied widely, including in our country. In some of the studies that I referenced in the earlier slides, studies done by my colleagues, Dr. Kaima and colleagues, actually did indicate that the females tend to have better, in their study, the females tended to have, one, better awareness of their blood pressure, and also better control. Probably because naturally females have better health-seeking behavior, but there could be other reasons. Now, a positive family history of hypertension is also another risk factor that we cannot do anything about. Black ethnicity is another risk factor. And then there's something about the genetics, because we're all different. For example, we all know that the genetics of blacks and whites is quite different, but the genetics also of a Black African, or an African, sorry, in Africa, and an Afro-American in the US, their genetics tends to be different from studies. And this genetics basically has an impact on so many things in terms of the way we metabolize our drugs, the way the bodies respond to our drugs. And these are studies that have come in that are quite important. So why are the elderly very vulnerable to developing hypertension? Or if they have hypertension already, why is it that it gets worse as they age? And when you look at the cartoon that I've drawn, this is a cross-section of a blood vessel at the different age decades as we get along. So when you look at the first cross-section here of a young person in their 20s, this is a very nice and smooth blood vessel that is very elastic. When the heart pumps blood through it, it's expansile and it will recoil nice and easily. But as we begin to get into our 30s, then we start to deteriorate in terms of organ function. Actually, as a kidney specialist, we start losing our kidney function from the age of about 30. So we usually, for example, grade our kidney function on a scale, for easy understanding, on a scale of 0 to 100%. So usually for us to say your kidneys are functioning quite well, we say your functioning is 90% and above. But after the age of 30, we start to lose subtle, there's a subtle decline every year, or a loss of kidney function every year of about 0.7% every year. Sometimes it could be a faster progression from things like high blood pressure, or diabetes, or drugs, or many other causes that we shall see. So as we get into the 30s and 40s, this nice blood vessel that is very elastic, that has elastic material in it, starts to lose its elasticity. So its ability to stretch starts to decline. So it starts to get stiffened. And as it begins to stiffen, the heart has to use extra force to push blood to widen that, that blood vessel. And in so doing, by causing that extra stretch, there are a lot of mechanical changes and damages that happen. And one of them is that that vessel starts to accumulate a lot of fat and a lot of calcium, and it makes it even harder and more stiff. So by the time you get to this other end of 60, into your senior years, one, the lumen in this blood vessel is narrowed. It is very stiff. And what this means is that there's going to be a reduced blood flow to these vital organs, like the brain, the kidneys, the heart, the skin, and it's going to contribute to the symptoms that we are going to see. Secondly, as we age, and I've said by the time you're 60, that percentage that I talked about losing your kidney function, the kidney starts to reduce its ability to handle an excessive load of salt or an excessive load of fluid. So you start to retain a lot more fluid, you start to retain a lot more salt because the kidney cannot get rid of them, because your kidney function has probably, by the time you're 60, your kidney function is probably falling to about 70% or less, depending on what other comorbidities you have. So this picture here is basically to show what happens to this pump, our heart. On the left is actually a cross section of the heart muscle. And like you can see it is all nice and smooth. And this is the normal structure of the normal heart. But when we get into stiffened blood vessels from the aging process, the heart is working actually harder. And because it's working harder, it tends to enlarge and thicken. Now, unlike the other muscles, for example, for those, if you see these young men who carry heavy loads and their muscles on the arms become thick, so the more they carry and the bigger the muscles are, probably the stronger they become. For the heart, this is the reverse. The thicker it becomes, like here, the weaker it becomes. So the narrower your blood vessels get, the harder it is for this heart to pump. So, and then the thicker the muscles will become and the weaker it will become. And this then will send you into what we call heart failure as a complication of high blood pressure. So what other factors actually contribute to high blood pressure, specifically in the elderly people? And one of them is that the elderly people tend to have many more comorbidities. You might find one elderly person with probably about 10 or more other comorbidities, and we have to attend to all of them. So what are some of these common comorbidities that the elderly person or elderly citizen has? The commonest one, of course, is diabetes, which is also quite common. Joint diseases because of wear and tear. Osteoporosis, because your bones, as we age, you're probably less active, you're less sun exposed. There are a number of elderly people who prefer to stay indoors, so they lose bone mass. They get into kidney disease for various reasons, and because they are inactive, they are going to actually put on a lot more weight. So obesity is the other. Others could be victims of stroke because of complications of high blood pressure. Others have thyroid disease. Depression, like my colleague, Dr. Noel, discussed in the previous talk. Depression is quite common in everyone, but quite common also in the elderly people. Gout is the other disease that we are seeing quite commonly in the elderly for very many reasons. Again, partly because of kidney disease and medication, high levels of cholesterol, which is quite common. Then dementia in the elderly. And there are very many who are socially isolated, especially the elderly, because very many of their children probably don't want to visit them. They are so busy because of their work schedules and all that. So all these contribute in one way, directly or indirectly, to the other factors that actually worsen or contribute to high blood pressure. Now, the other that is very important and very pertinent to me is the medications. Now, as we grow older and because they have so many comorbidities, and a senior person is more likely to have or take very many medications, like my old friend here. And why are we worried about these medications? The more medications you take, the more the interaction among them is. And why are we worried about these interactions? They're what we call drug-drug interactions. And what these do is that one drug will influence the effect of another drug. For example, you might be taking your high blood pressure drugs and taking another drug for some other condition. And that other drug for the other condition actually makes your pressure medication less effective. And that's what we call drug interaction. There could be other interactions of the drugs you're taking with food, particular foods. There could be interactions of your drugs with herbs, and these are quite common. There could be interactions of your drugs with supplements. So not all supplements are actually innocent supplements. And I want to give an example here, a very practical example. Many of you are probably aware of
where are they selling them?
I don't know if someone could please mute, because we're probably getting interference. So I wanted to give a specific example of a herb and a drug interaction. And we are all conversant with a flower called hibiscus. Hibiscus is quite common. I'm sure most of you have seen it. It comes with a very nice, beautiful red flower. And I think other flowers are pink. Now, hibiscus has lots and lots and lots of benefits, so many. And it has been used over the years, for hundreds of years, for, I think, as an antibiotic, as what they call an antioxidant, as a laxative for people who have constipation. Now, hibiscus, for diabetics, on its own, also reduces blood sugar. Hibiscus also lowers high blood pressure on its own to some extent. Now, for people who are, especially the elderly citizens who are taking hibiscus and blood pressure medication, sometimes run a risk of getting into very low blood pressure when they take hibiscus with their medication. So when we shall, as we go forward, when we're evaluating an elderly person with high blood pressure, it's incumbent upon us, the healthcare workers, to explore as much as possible all the drugs that the senior citizen is taking. And a very good example of hibiscus drug interaction is a drug that probably a number of you are taking. There is a drug called losartan, one of the common hypertension drugs that we use as clinicians. Now, what hibiscus does to this losartan is that it exaggerates the effects of losartan. So if you're taking a particular dose of, say, 50 milligrams, and you combine that with your hibiscus juice or hibiscus tea, you're going to be like someone taking a double dose of the losartan. So your blood pressure is likely going to drop further. And this is why we are very pertinent about so many drugs that a senior citizen or an elderly person is taking. So this is very important. Now, on the other hand, there are some drugs that will actually worsen the effects of the antihypertensive drugs that you're taking. They will actually cause those drugs to actually work even better, or either to drop or will inhibit their effect so that there is no effect of your blood pressure medication. So that's the point I'm trying to drive home, that multiple drugs is a very common problem on its own, and can cause quite a number of problems in the elderly people. Now, what are some of these drugs that are quite common that we prescribe as us doctors, or are self-prescribed by quite a number of people? One of them are painkillers. And like I said, the common painkillers, especially for joint problems, because as we age, there is wear and tear of joints. So someone will want to buy a diclofenac tablet or brufen for the joint pains. Yes, they're going to help you with the joint pains, but these drugs actually do cause high blood pressure. Cold and flu medicines, especially the ones that we spray in the nose, have certain particular active substances that will increase your blood pressure. Antidepressants, I just gave a few examples there. Steroids, if you do remember during the COVID outbreak, there was a famous steroid called dexamethasone. Others call it Dexa. We see it quite a lot being used and misused by so many people. This drug has a potential of actually raising your blood pressure. Together with its sister drugs like prednisolone, there's another one called Diprofos that many of our colleagues that deal with bones inject in joints. I'm not saying they shouldn't use them, but we always use them with caution. Hormonal birth control pills for the ladies. All, on the other hand, when our mothers or wives age, there are those who are given what we call hormonal replacement hormones, and the one that they usually use is estrogen. This usually also can cause high blood pressure. Herbal remedies. I just gave a few here. There's a herbal remedy called licorice. It's contained in tea. It's contained in I think a few sweets and many other things. These also can cause high blood pressure. Now, there are stimulants like caffeine, energy drinks, and I also included alcohol. And we'll have a very brief discussion about alcohol, especially if used in excess. The other drugs that can cause high blood pressure to very, very worrying levels is illicit drugs, cocaine, amphetamines. And now we know that some of these drugs are with us. And they're quite common in very many schools, like you've read in the media. And I highlighted this because there are some elderly citizens who probably started using some of these drugs when they were young and have gone into their late years while using them. So we also have to look out for this as one of the potential causes. Now, how does high blood pressure present? I highlighted this in red because high blood pressure many times does not have any symptom. And this could probably go on for years. And one of the reasons for this is that as the pressure goes up, the body has got a mechanism in which it adapts to that high level. And because there is that adaptation, you'll basically get no symptom at all. And you think you're normal. It's not until you actually go to your healthcare worker and take a measurement. Secondly, there are common symptoms like headache or dizziness. So do not ignore any headache. Headache could be caused by many other conditions, but high blood pressure is one of them. Remember I told you high blood pressure causes a reduction in blood flow to many organs. So in the eyes, you're going to get visual disturbances, including blindness, fatigue, unnecessary fatigue. So it may not always be that you're overworking. It could also be high blood pressure. Sudden nosebleeds, frequent urination, especially at night. Now, usually when the kidney is disturbed, sometimes it responds by you passing out frequent urination, especially at night. The way God created us is that we are supposed to have a good, nice quality sleep during the night without any disturbance of waking up in the night. But sometimes this high blood pressure reverses that sequence and you pass out a lot more in the night than during the day. Or on the other hand, you could have reduced urination, but the causes of this are also so many, but high blood pressure is one of them. So you could get chest pain because of the heart discomfort. You could get numbness or tingling in the lower limbs. You could get swelling of the feet. It could be a sign of high blood pressure, but many other causes could be out, or blackouts. Vomiting is the other. Frequent falls, especially in the elderly, because they might actually have what we call minor strokes in the brain that could give them dizziness. And this could lead to frequent falls. The other is memory lapses. And now, by the time you start getting memory lapses, this process has, which is probably an indication of dementia. This process doesn't happen, say, within a day. It has happened over years. And actually, what we know that science is telling us is that the pressure that is not well managed in the middle years, say between 30 and 45 or 50, if you do not manage that pressure during those years where a couple of us fall, those are people who are actually likely to get dementia or Alzheimer's disease later on in their early years. So this is one of the importances of managing high blood pressure. So tinnitus or ringing in the ears is another cause, or sorry, presentation of high blood pressure. Palpitations or awareness of your heartbeat. And this is because the heart is actually using a lot more force to pump blood through those narrowed blood vessels. Increased sweating, muscle aches, cough, and difficulty in breathing. And again, this big problem for the men, sexual dysfunction. And this, like we know, will cause more anxiety, more stress. So it will become a vicious cycle, worsening high blood pressure. So what are the signs when we see you as healthcare workers? Of course, we are going to see a raised blood pressure. Remember the table I showed? We are going to look into your eyes. Sometimes we actually send you to the eye doctor. Sometimes the blood pressure is actually seen for the very first time when you visit your eye doctor, because you cannot see. And then your eye specialist will tell you, oh, there is damage to your eyes because of high blood pressure. Swollen feet, we might feel hardened blood vessels, like I talked about, or when we listen to your chest using that gadget we call a stethoscope, we might hear abnormal sounds in the heart that might actually tell us that you have high blood pressure. So as for elderly citizens, how do we assess? Now, the assessment for the elderly is a little different from the standard evaluation of the younger people. And there are many reasons, because we take into account a number of factors. One, because they have multiple comorbidities, the frailty of the patient, and then we also have to take into consideration the concerns and needs of the caretakers, because we at times and many times see senior citizens for the first time when they actually already have what we call cognitive dysfunction or memory losses. So we have to take into account, and at that time, we actually want to discuss a lot more with the caretaker who is going to look after this patient. So what do? We take a very, very, very detailed history all the way from the past. We carry out a very detailed physical examination from the head to the toe, and we do a very selected and focused investigation. Now, a point to note for the senior citizens, sometimes this whole process of evaluation is quite tedious and exhaustive, and it causes a lot of exhaustion. So we sometimes have to break it up and do it so that we don't cause exhaustion to the patient. So we might have to repeat it, not repeat, but follow up within a few days to complete and have a very good idea of what's going on. So what do we do during this whole evaluation? One, we want to assess the general well-being of the patient. We want to look at what you're presenting with. What do you have? Is it chest pain? Basically the symptoms you have. We want to explore all the drugs that you're taking, even the drugs you took in the past, because some of the drugs you took in the past could actually be the causes of your high blood pressure. We want to look at your social habits, both past and present. In this, we are looking at things like alcohol intake, smoking, and all that. Your sleep quality, like I said, the nutritional patterns. We want to look at the nutrition because this is very pertinent when we come to treatment. We want to look at your past medical records, if you have any. We want to look at your past surgeries, if you have undergone any past surgeries. There are some surgeries that are actually might contribute to this. Now, like I said, there are important drugs that we want to know. What are your the drugs you're taking? If you're hypertensive, what drugs are you taking? And here we are trying to look at the dosages. Are they high or low? What other drugs are you taking? They are what we call water pills, which you may be taking for various reasons. And these may be causing a few complications. The painkillers, the antidepressants, the drugs that I mentioned earlier. We want to look at all these. Secondly, then we examine and want to take a blood pressure measurement. And there are particular conditions we want to take these blood pressure measurements. So for one, it has to be taken in a very nice and quiet environment. Someone has to be calm. And if we are evaluating a senior citizen, we want to take this blood pressure in the two arms. There's a reason why. And one of the reasons is I talked of narrowing and stiffening of these blood vessels. Now, this does not happen. It's not evenly distributed. You might find that one hand is still a little normal and the other hand has actually stiffened blood vessels. And on this unfortunate day, I will call it unfortunate, I might take the blood pressure in the normal hand that has the less stiffened arteries. And in that hand, the blood pressure will actually be normal. Yet the other hand that has stiffened or clogged blood vessels will actually have a very high blood pressure. So when you go to your healthcare worker, please ask them to take the blood pressure in the two arms. Now we consider the higher reading of the two. And subsequently, we shall be using probably that higher reading or the hand that exhibited the higher reading. So we also want to take the blood pressure in the sitting, if someone, and then standing position, if the person can stand. Or if they can't, then we can do it probably in a lying position, and then we repeat it in the sitting position. And the reason we do this is when we get damaged blood vessels, there's an electrical system that is attached to these blood vessels. There are particular small nerves that help these blood vessels to enlarge and recoil. Now that system is usually damaged by many diseases like diabetes, the aging process, and that system basically causes problems with adjustment of your blood pressure when you stand from for example, when you're raised from a sitting position or from a sleeping to a lying position, you might get a bit of dizziness. Your blood pressure will suddenly drop because that system cannot adjust for that correction. And we've seen that complaint in a lot of elderly people, that the complaint will be that if I get up from a sitting position, I get dizzy. So we are trying to assess for that in the elderly, and more so in the diabetics. So the other things we assess are brain. So we assess your mental capacity, memory, we assess the eyes, we assess the heart, and the other organs. We also want to assess the way you walk and your gait and the other organs. Then we carry out a battery of tests, again, depending on what we found in the history and our physical exam. And there are so many tests that we are going to do. Then we also carry out any other tests that may not be directly related to high blood pressure, but are going to impact on the well-being. For example, for the men these days, we are encouraged to do assessment of the prostate, especially after the age of 45. For the ladies, we encourage a pap smear or breast exam, because these are very common cancers, and their treatments have an impact many times on your blood pressure control. So when it comes to treatment, we divide this treatment into two. There's the non-drug treatment and the drug treatment. And I will quickly go into the non-drug, which is very, very, very important. And I'm highlighting this one in red because this is where I wanted to spend a little bit of more time discussing. So salt reduction, physical activity, health, very healthy diet that is rich in fruits and vegetables, and we'll see why. Reduction or complete stopping of excessive alcohol consumption. Cessation of smoking, because this damages blood vessels, like I already alluded to. Quality sleep is very, very, very important. And at this point, I would say for anyone above, say, 40 years, we encourage at least adequate sleep of a minimum of about 7 to 8 hours of sleep. And one of the questions, like I think Herbert mentioned, the gentleman in South Sudan who sleeps for 2 hours and sweats a lot, all these probably are contributing to his high blood pressure. So management of stress is very important. Weight reduction, this is a very big challenge in the elderly because one of their comorbidities and the others, but we will probably see how this can be done. Decrease in very fatty foods. And then secondly, we encourage everyone, and but most especially the adults, to keep hydrated. I talked of sudden blood drops, especially when you're standing because of damaged blood nerves and blood vessels. So we want people to keep well hydrated. And even when you do exercises, because you're going to sweat, you're losing water, that has a direct effect on dropping your blood pressure and basically enhancing the effect of your blood pressure medication. So keep hydrated. So I'll start off with salt, because this is very, very, very important. Now I will look at what is recommended, and I will go to what the World Health Organization that we're all covered with. It recommends that we should be taking 2,000 milligrams, which is 2 grams of salt per day. The American Heart Association encourages us to take a maximum of 2,300 milligrams of salt per day, which is 2.3 grams per day. I will break it down very shortly, what these figures mean in our day-to-day lives. But important to note, why are we emphasizing salt reduction? Now, as we grow older, I did mention that especially the elderly become very, very, very sensitive to salt. Because what this salt does is that it's going to retain a lot of fluid in the body. And each time you take a huge load salt, it attracts water. Now remember, you have stiffened blood vessels. You're increasing your blood volume. So the heart has to pump extra hard to push that extra volume in a very limited space that is not expansive. So there's going to be damage to those blood vessels because of salt. And secondly, salt has also got a direct constricting effect on your blood vessels. So salt directly narrows your blood vessels if taken in excess. And that's why we actually emphasize taking a moderate amount of salt. On the other hand, we do not want to say completely do away with salt, because we also need the salt. Because low salt, on the other hand, or no salt at all, actually causes dizziness, causes bone loss, and causes falls. So there is a trade-off, there is a limit. So we want salt to be at least within these limits that WHO has recommended. So if I'm to break it down, this is iodized salt that we use every day. And if we are to use this teaspoon, this is a teaspoon that all of us use every morning when we are making tea. A quarter of that teaspoon of salt is equivalent to 600 milligrams of sodium in that. Now, remember, I said the WHO is telling us that we should take a maximum of less than 2,000 milligrams of salt. So if you're going to use quarter a spoon of salt in whatever you're preparing, that's already 600 milligrams of salt. If you're going to use half a teaspoon, that is 1,200 milligrams of salt. If you're going to use a whole teaspoon of salt, the normal salt, the iodized salt, that is 2,400 milligrams of salt, way above the recommendation. Now, other people might argue, because I have seen this quite a lot. Others say, no, for me, I don't use the normal salt. I go for the sea salt. The same happens. A quarter a teaspoon of sea salt will give you 530. And a full spoon of sea salt is giving you more than the recommended. What about those who use Himalayan salt? Himalayan salt is, it looks nice, it's nice and pink, and people think that Himalayan salt is innocent. It is not. Actually, the point to take home here is all salt is salt. So whether Himalayan, whether sea salt, whether iodized salt, they are going to give you the same effect. So Himalayan salt, a full teaspoon is going to give you more than the recommended. Now, a number of us love ketchup on our food. And I'm just giving a few examples of where we accumulate salt. So ketchup, a small tablespoon full of ketchup is going to give you 197 milligrams of salt. So if you're going to use more than this, you could do the math. You could see it will double. The more you take, the more salt you take. What about bread, which many of us actually think, because it's sweet, is innocent? So as an example, a small bun contains roughly between 80 and 100 milligrams of salt. So if you're eating 2 buns, you're probably taking about 200, between 160 and 200 milligrams of salt. And if you took probably a bun with, say, bacon, and on that bacon you've put ketchup or tomato sauce, you're probably already in about 500 milligrams of salt. What about Coke? I love Coke myself. Diet Coke, people think Diet Coke, because it's called Diet Coke, is innocent. No, it is not. It also has a fairly low, but some good amount of salt. Now, there is this seasoning called aromat. It's quite common. I have seen it in quite a number of homes. And it's good for, it basically makes food tasty. But it's one of those seasonings that have a very high salt content in it, very, very high. When you read the food label on some of these salt, on aromat seasonings, some of them actually go up to about 3,000 milligrams of salt per serving. Now, usually you have to note that when you're looking at these food labels, try and look at the serving size. So they may tell you for each half a teaspoon of this serving is equivalent to this amount of salt. And that will gauge you how much you should eat. So the take home here is that wherever you can, and you're buying foods from the supermarkets, please try and read the food labels. That's the message that I'm trying to bring here. Now, there are other foods that contain a lot of salt. Like I said, breads, the processed meats, like the bacon, the beef, the tinned fish, and all that. Soy sauce, which the mothers on this forum are probably using every day. And then there are these little foods that we give to our children, or yobazukulus, the seniors, the crisps, the gorillas. Unfortunately, many of them do not have the food label that shows salt, but they do have a lot of salt. Now, another big point to summarize this salt issue here is on this table here, that one of the myths that I studied on, where people tell us that because I do not use the salt shaker, I am actually comfortable. I don't take a lot of salt. The salt shaker on your table contributes probably about 6% of the entire salt that you're going to take. Majority of the salt that we take in is actually in the processed foods that you're going to take. For example, if you're having breakfast every day that has bread, that has bacon, that has the tinned beans, you're already in this 71%. Then when it comes to lunch and you're going to add your table salt, this is 6%, but you've already taken a huge load of sodium in the other foods. So that's the message that that salt can have, and we've really seen the effects of the salt. Now, what about the physical activity? And someone in one of the questions also mentioned that what physical activities can they prescribe for their elderly people? Now, There are benefits of physical activity, so many, and we know that being physically inactive is associated with so many things. One, high blood pressure, sugar levels go up, and then obesity goes up, heart diseases and all that. But there are benefits through various ways in the body. The more you exercise, the body releases very essential hormones. Let me call them hormones that actually help to open up your blood vessels. And the wider the vessels are, the lower the blood pressure. So exercise is basically good. And in addition to that, for those who are diabetic, exercises of course also help to control blood sugar and also help to control weight loss. Exercises also help to strengthen your bones and muscles. Remember, as we age, everything is actually aging. So as we age, there's also reduction in muscle strength and muscle bulk and bone loss. So the more you exercise, you're actually strengthening these. And what's the recommended? The recommended is actually 150 minutes per week. And if we break this down, it's actually 30 minutes per day of exercises. Now, what do we recommend? We recommend, before we recommend any physical activity, actually, we put a few things into consideration. One is the degree of frailty of the patient, the level of disability and the complication, the social support, the level of comprehension. And that's why when we're assessing the senior citizens, we want either the spouse or a house help or someone with them. We also have to factor in the comorbidities. There are diseases like Parkinsonism, which we commonly call here obuko in our local language. These people probably may not be able to do some exercises. So this exercise is focused on, we individualize it based on the patient. And then there are those who have dementia. Dementia, is a disease that affects memory. We don't want these, for example, to do walks on their own. Otherwise, they might actually walk and forget where they are going. And this has happened. So we categorize the elderly in these three groups. One, there are those with preserved functional status. Those are the ones who basically are able to be, who are self-independent and can probably follow all these instructions and can do exercise on their own. On the extreme, number 3 here, are elders with significant loss of function and loss of autonomy. Probably these are the ones who are bedridden. And these ones, of course, the kind of exercise and physical activity we are going to advise are going to be passive, probably at the bedside. And here we usually call in the bedside physiotherapists to help us. And then there's a group that falls in between, who have moderate functional decline, but they have preserved autonomy. So we categorize the elders in these 3 groups before we prescribe these exercises. So what do we prescribe? Brisk walk, for 30 minutes a day is good enough. Cycling for those who can still cycle. Dancing is a very good exercise for those who can actually dance. Aerobic exercises, these are usually fitness, stretching, but again, this will fit a certain group and not the other, depending on the comorbidities that I've talked about. Gardening, many of you have farms or big compounds. Please get involved in some of these things, like say mowing if you can, or raking leaves. Running or jogging for those who still have strong joints. Swimming is a very good exercise for those who can still do it, but remember, you have to go to swim with a lifeguard nearby. Doing housework is also some kind of activity, and make it fun, especially with your bazukuru or with your spouse, for that matter. Now, a point to note, always remember to hydrate before your exercise or after, to avoid sudden drops, especially if you're going to get into excessive sweating, because that will have an impact on your blood pressure. Now, what about stress? Now, this is a bit controversial because stress comes in all forms of different forms. But what do we recommend as stress relieving measures? Because stress has got quite a number of negative effects, and some of the recommended are taking walks in nature, meeting friends for a good laugh or for a coffee or a walk as a group, reading a very interesting book, inspirational books for that matter. And these days they're audio books for those who can afford. Listening to nice music, not the bazukulu kind of music that will actually cause more harm. Playing a favorite sport if you still can. And I cannot emphasize this anymore, adequate sleep. Please have adequate sleep. And they recommended here for the elderly citizens, 7 to 8 hours of quality sleep. The other is things that we want to look into when we are, this is now of course, I've not mentioned the others like alcohol, but maybe a point to mention, I did mention something about wine. Specifically probably mention a slide or two about wine because I'm running out of time. Now, the alcohol, we want, if it was possible, of course, no alcohol at all. But everything is probably, the message should be in moderation. So I'll give an example of wine because I in one of my first slides was a myth about wine, that if we recommend wine as healthcare workers, then someone should go and take wine. No, that is not true. So what we recommend as wine, the recommended is 1 drink per day for the females. And what does that 1 drink mean in terms of quantity? Because as scientists, we are interested in numbers. Quantity means 150 mils of red wine in particular for the ladies per day. For the gentlemen, we recommend 2 drinks, which is 300 mils of red wine per day. Now, why red wine? Red wine has, in that moderation, in that amount, has got very many other potential benefits for the heart health, for the good health. It has what we call antioxidants. Antioxidants are substances that actually remove toxic substances from the body. And one of those, for those who have done a bit of science, is something that they call polyphenols. Red wines have that substance called polyphenols that helps in reducing blood pressure, reducing cholesterol in moderate amounts that I've mentioned. That same polyphenol is also contained in foods like the bitter berry. Bitter berry, I think, is what we call the katunkuma. So eat lots of that if you can actually get it. And those are the same contents that are available in the other things like the fruits and the vegetables, because they contain blood lowering ingredients like potassium and many others. So very briefly, let me go to the drug treatment. Now the drugs, I will not discuss specific drugs, but I want to make particular point on what to consider when we are treating high blood hypertension using drugs in the elderly. And there are things we have to put into consideration. One of them are the other comorbidities. Remember, I said many elderly people will have more than one other comorbidity. So we put that into consideration. We want to consider the frailty of the patient. We want to assess the ability of that person to follow instructions, because we don't want to give them instructions of take 2 times 3. What does 2 times 3 mean? 2 times 3 for someone might mean that I'm going to take in the morning, at break, and at lunch. The other one might mean that it's going to be taken 8 hourly. So what do we mean? Can someone follow those instructions? What the complexity of the drug dosing schedule, probably. And then do they have any supporting care? Someone to support them, to remind them that you need to take your drugs or to honor appointments. And then we also consider the side effect profile of these drugs that we are giving. And then we want to consider as fewer drugs as possible, because the more drugs, the less adherent or compliant they will be. And then very important these days, we know the economy is not so good, the cost of the drugs. We don't want to give you very expensive drugs, yet we can get cheaper ones that will actually do the job very well. And then, like I mentioned earlier, we'll also consider potential interaction of drugs. And I'm very passionate about this because we've lost very many people, not because of the disease, but because of drugs. or drug interactions. And then we also look at the lab results that we have done. Many of them guide us on which drugs to give. The kidney, the liver, and all that, the heart functioning. So we're also concerned about the dangers that these drugs actually come along with. And there are so many side effects that these drugs actually pose. One of them is that we are treating high blood pressure, but there are those drugs that are going to actually cause excessive urination. So even the timing of the drugs matters. For example, there are drugs that we give that help to reduce that salt load that you're taking. And reducing that salt load means frequent urination. So I wouldn't want to give you that drug at night because I know your quality of sleep is going to be interfered. You're going to keep waking up. So I would rather give you that drug in the morning where you are awake and maybe give you another drug in the night. So there are drugs that cause dizziness. I would rather avoid those because these are going to actually cause falls. And like I mentioned, as we age, everything is actually aging. The bones are aging and are becoming brittle. The blood vessels are aging and are becoming stiffened and very liable to burst. So when you get a fall, you're likely going to fracture your bones, or you're going to actually lead to a burst of your blood vessels, especially in the brain. And we've had these accidents. On the other hand, these drugs can actually lower your blood pressure to very dangerous levels that will actually cause complications, just like what high blood pressure does. There are drugs that cause swelling of the feet that will make you uncomfortable to walk or to wear shoes. So we are also cognizant of such drugs. There are those that will cause headache. There are those that will cause skin rashes because they are drugs that that contain sulfur. And we know in this part of the world, there's a good number because of our genetic makeup that is predisposed to or is at a risk of sulfur allergies. So we during our assessment, we also want to know what kind of allergies the person actually has. There are drugs that cause cough, very common. And this cough tends to be much more common in the females than the males. And when it happens and it's bothering someone, we have to change. There are drugs that cause body changes. Enlarged breasts, for example, in men. And this is quite, it can cause a lot of anxiety. So we sometimes have to cancel them before that, or we give them another one that does less of this side effect. There are drugs that cause constipation, and constipation comes with it many other complications like infections. It can lead to urine retention, which will also worsen other infection. Constipation can cause blackouts, especially for those who have damaged nerves. And again, this other subject comes down, and I've been asked thousands of times by the male patients that, doctor, there is something happening to me back home, and that is reduced sexual drive. So there are drugs that actually does cause this, and this causes a lot of anxiety and stress in the homes. So many times we are forced to switch to other drugs that actually that will make your life a little bit more comfortable as a senior citizen, because it's not written anywhere that the senior citizens should not enjoy their years of aging. So as I conclude, what is the future holding in terms of management of hypertension? And one is we need to put emphasis on lifestyle modification, because this is the cheaper way of managing high blood pressure, especially in the young population as they age. Remember, I mentioned that studies have showed us that high blood pressure not well managed in the middle ages, in the 40s or early 50s, these are patients who are at a very, very, very high risk of getting cognitive dysfunction, mental illnesses, and dementia later on, 20 years later. So it's good to manage high blood pressure in those ages. So there are plans by pharmaceutical companies to develop what we call a polypill, or one drug that has almost about 5 drugs within it, for example, so that we reduce the burden of the multiple drugs that someone is taking. That work is ongoing. We also want to emphasize reduction of these modifiable risk factors that I talked about: the smoking, the alcohol, controlling diabetes, air pollution, which is becoming a very big concern worldwide. Salt reduction, I cannot emphasize this any further because it's very key. And then as the world moves into the world of technology, the innovators are working day and night to make very good innovations in a way we measure this blood pressure with machines. One, there are plans by very many different companies that are actually developing what we call cuffless blood pressure sensors, wireless smartphone enabled upper arm monitors, or there are those that are actually into remote monitoring technologies that are using Bluetooth technologies or wearable trackers. There are those that are actually doing medication alerts, reminders, especially, and these are usually targeting the elderly citizen. And one of the reasons is that I didn't mention earlier is that when we are measuring blood pressure, the traditional way has always been, you come to my office and I take your blood pressure, say at this time at 10 a.m., but I do not know what your blood pressure is going to be at 3 p.m. So the other way around, and many times, especially in the elderly or the young children, when they come to our rooms, there's a lot of anxiety and their pressure might be falsely high. And that's what we call the white coat hypertension. So to mitigate that, we encourage a lot of home blood pressure monitoring. But even that sometimes may not be so accurate. So there's what we call ambulatory blood pressure monitoring, where we attach a cuff on your arm, on your upper arm, with a very small gadget that is going to take your blood pressure throughout the day. But the challenge with that, especially with the senior citizen, that it's going to keep waking you up because it's going to keep compressing your hand, say at 2 a.m., then again at 3 a.m. So you may not have a comfortable sleep. But that particular kind of measure gives us a clue on when your blood pressures are high and when your blood pressures are low, and it helps us plan. Now, these innovators are coming up with these innovative ways of relieving that stress so that you can sleep well and have these cuffless blood pressure monitors. And we are looking forward to this kind of technology in the near future, and we hope it comes in handy. So the take-home message, and this is my last slide, is that this is a very common problem, and like I've said, it increases with age. It is manageable with appropriate non-drug, preferably as first line. And if this is not working, then we add on the drug therapies. And please take time to know your blood pressures. So again, feeling okay does not mean that you do not have high blood pressure. So take your blood pressure readings. And you can actually age gracefully with no complications of high blood pressure. I want to thank you for listening to me. Thank you. So from this time, I probably will entertain questions at this point in time. Sorry, I think I have taken more than the time I was allocated to, but I hope I've made a few highlights and take-home messages for us all, especially the senior citizens on the forum. Thank you. Back to you, Chair.
Thank you, Dr. Makanga, for that presentation. As we wait for the chair, I'll request you to answer some questions that have come up in the chat. There's a request to comment about products like low salt and also the benefits of dark chocolate, 65% plus cocoa. Yes, if you could comment about those in the meantime. Thank you.
Thank you. Yes, about dark chocolate, let me start with the low salt. Yes, the recommendation, remember, from the WHO requirement of less than 2,000 milligrams. So when you say low salt, we want to know what the content of low salt means. And I've seen this. The low salt usually, I think, is about 150 milligrams. I think per serving, and like I said, you always have to look at what that serving size means. We definitely will recommend the low salt. But along the way, sometimes we also measure what your salt levels are in the blood, because we don't want your salt levels to go so low in the blood. Low salt has also got very many other adverse effects. Among them is, I think I mentioned it, it might be actually low blood pressure. The other is actually loss of bone mass. So low salt can actually cause osteoporosis with frequent falls. But yes, we do recommend that low salt. And very briefly about the dark chocolate. Now, chocolate is one of those recommended foods that you can take, again, in moderation. The reason is the dark chocolate from various studies also has certain compounds that are known to be antioxidants, that are known to relieve stress, that are also known to reduce blood pressure. But on the other hand, chocolate has also got a very high load of calories. So if taken in high quantities, can also actually make you put on a lot of weight. So again, it's a cutoff. It's in moderation. Do not take lots of chocolate. The amount here now is the question. Sometimes we have to get guidance from a nutritionist, but the take-home point is that a little bit of chocolate is actually very helpful, and we do recommend it. I think, I don't know if I answered the person right, correctly. Any other questions that we have? I'm sorry, I can't see the questions on the chat.
Right, there's a question to comment on.
Go ahead, Philippa.
Okay, to make a comment on dates and potassium salts in the management of blood pressure.
Okay, on dates, the first one was a comment on dates.
Yes, dates, is it a fruit? Something.
The fruit.
Yeah.
I have no experience about the dates so much. I will probably ask someone in the audience, a medical health worker who has a lot more experience about dates. I'm not sure what the dates actually contain, but I have heard about the benefits, some other health benefits of dates. But I'll make a comment about the potassium salt. So sometimes we actually recommend alternatives to sodium chloride. Sodium chloride is a salt, and the alternatives could be actually the potassium salts. Now, the challenge with potassium salts is that, of course, it will not make your food as tasty as the other salt, but it is healthier. Now, potassium on its own has a direct effect on the blood vessels in that it relaxes them better, unlike the sodium, which actually constricts them and narrows them. And that's this very reason why we encourage eating lots of fruits and vegetables, because these have a lot of potassium. Now, on the other side, for patients who have kidney disease, where my specialty is, then we discourage the potassium salts. Why? Because when we have kidney failure, the kidney now cannot handle a potassium load. And once the potassium accumulates in the body, it has a direct effect on the heart. It can actually cause what we call a cardiac arrest. It can cause muscle weakness, which can lead to falls. But our most important fear in kidney patients or kidney failure patients is that it can actually cause a heart attack. But in the healthy people with normal kidney function, we encourage the salt, alternative salts. Sorry, the potassium salts. Okay, thank you. Any other question?
Tina, please go ahead with your question.
It was a question in the chat on whether hypertension is hereditary, but I suspect you covered it a little in the beginning. Maybe the person missed it. And also to comment on herbal remedies without other drugs, do they have side effects? So it's two questions. Thank you.
Okay, thank you, Tina. So there's lots and lots and lots of work that has gone into studying the genetics of hypertension. And yes, we know it's true, hypertension is hereditary. Now, what I didn't mention, because this is a very wide topic, 90 to 95% of patients with high blood pressure or hypertension, the cause is not known. The other 5 to 10% is where we know the cause. Now, of these 90 to 90%, there is a genetic component where the hereditary nature falls in. So if you have, for example, a parent who has hypertension, there's a high risk of these children developing hypertension later in life. If you have the two parents having high blood pressure, then the risk is even higher. And we've also gone ahead, maybe let me also mention this, that studies have also shown us that, and this specifically goes to the mothers, the young mothers probably on the forum, that if a young lady is pregnant and is malnourished or is not feeding well in pregnancy and gives birth to a low birth weight baby, or what we call a preterm baby, that baby is going to be born with all organs small. Because they are small, everything else is going to be small. The heart will be small, the lungs will be small, the kidneys will be small. Now, in particular, in my area of specialty, those small kidneys, later on as these children grow, are going to actually cause high blood pressure in future. And these are studies that have been done in very many countries where they have followed up preterm babies all the way into adulthood. And majority of them actually end up getting high blood pressure. So and that's why we encourage mothers who are pregnant or who are planning to become pregnant. Now this is for the young ladies, to always try as much as possible to have a very nice, healthy diet to avoid being malnourished. Now that also comes with many other comorbidities, especially for those preterm and small babies. They are also prone to getting diabetes later on in future. And that's why nutrition is a very, very, very big issue. Now, the other question about herbal remedies is another very pertinent issue. Now, not all herbal remedies are harmless. I mentioned a few that actually on their own can actually lower blood pressure, which is very good. But there are others that actually cause high blood pressure because they damage blood vessels, they damage the kidneys, they damage the heart or damage the liver. And the other question about herbal medication is someone will argue that they are natural products. Yes, they are natural, but they have many other ingredients that we do not know. That is one. So on their own, many of us, what I would call Western trained medical doctors, do not have very good experience with herbal remedies. We are just trying to learn them over the years. I know there is someone, I think in Wandegea, called Dr. Namatia, who's trying to study lots of herbal remedies and the active ingredients that they have. There are many out there where, first of all, some do not even have a particular dosage. So someone will give you a whole, probably, bottle, and we don't know what they base their dosages on. So on their own, I cannot concretely say, please take only herbals. I would actually discourage them because I do not have enough evidence to support them. Thank you. And then if they are mixed with other drugs, I already talked about the interactions that they can have with the modern drugs. So we rather avoid them if you're taking modern drugs, or if you're taking them, maybe let them be prescribed by someone who has done extensive research on their whole profile, the side effect profile, on the effects they have on your body, on your liver, on your heart, on your blood vessels, and all that. I think that's what I'll comment about the herbal remedies.
Thank you so much, Dr. Gyaviira. I'm sorry about the technical glitch I had earlier on, but I wanted to say that you've been really talking to the heart and the house of each one of us, for all of those who are here, and we've managed to keep above 70 throughout the 1 hour. You've talked into our houses, our kitchens as ladies, and everything, and it's been down to earth, understandable by each one of us, medical or non-medical. Thank you so much, and can we all give him a big clap, please? You can go to your reactions and give him a big clap. I want to thank the host for giving us this extra time. We've run past our allotted time, but I think it's been very, very much worth it. Thank you so much, Doctor. I would like to give you a few notices. One, thank you so much for all of you who have posted your emails in the chat. Please continue giving us your contacts, because this is one way of reaching you and keeping all of us seniors and caretakers together. We hope to have a session every last Saturday of the month, as we said at the beginning. And our next talk will be on the 25th of June at 10 a.m. Please remember to send questions and comments, and even choice of topics you might want us to deal with. Send them to the email which was given to us earlier. And you can send to any of us, Dr. Philippa Makanga, Christine Kadama, and CHRISTINA Kadama, and any other contact you might come across who have been on this chat. There has been a comment or a question about where do the elderly or the seniors gather. And I want to suggest the following answers. One, we have started gathering here online. It may not be very physically active of us for the 1 hour we spend here, but it gets us together and it helps us a lot. We get educated and all that. There are several
We seem to have lost our moderator. I think it's the technical difficulties. But thank you all for coming. Please put your email in the chat and we will send you the presentation and we will send you the slides. So thank you very much and have a wonderful rest of the day.
Thank you, Tina.
Thank you.
All right, thank you, everyone. Have a
Thank
good
you.
weekend.
Bye.
Bye.
Thank you.
Thank you, everyone.
Thank you and thank you. Bye.
Thank you. Thank you.
Thank you so much. Thank you, Doctor. Thank you, all the organizers. About the South African Integration. Thank you so much.
No, you
Thank you.